Hi, this is Jim Collins. Welcome to this interactive training program that's going to help you understand the optimal way to document and code your visits with patients. This program consists of a series of short narrated training programs. These are each followed by a couple of multiple choice questions that are designed to confirm understanding of the topics presented. At the conclusion of the program, you will see a report card that tells you overall how good you did. It will also ask you to submit your name so that we can keep track of your efforts. This first graph illustrates the documentation requirements for your most common services, which are your established patient office visits. And the graph on the right-hand side shows you your documentation requirements for follow-up visits with patients in the hospital setting. On the bottom of each graph, you can see are the actual CPT codes, so they basically increase in level of service as we move to the right-hand side of each graph. What you'll see is that above each of the codes are the documentation requirements for each of the three key components of documentation, which are illustrated down here on the bottom, and those are the history, the exam, and the complexity. For any given CPT code that's graphed out on this particular page, the documentation requirements that you see only need to be met or exceeded for two of the three key components. So if you have a history that comes up to the third highest possible level of service, the complexity comes up to the third highest possible, but the physical exam is only up to the second highest level of documentation. The fact that that physical exam falls a little bit short of the mark necessary to support that 99214 is not going to be a limiting factor. Another thing this graph shows are your reimbursement rates. So going from a level 3 service up to a level 4 service creates a considerable impact on reimbursement. Similarly, when you go from a level 4 visit up to a level 5 visit, it increases your reimbursement to a considerable fashion. When you think about how many thousands of patient visits you're going to have over the course of a year, increasing reimbursement by 40% just for billing a higher level of service when appropriate can quickly add up to around $100,000 per year per physician if you're traditionally been billing the lower levels of service. So it's important to understand the right way to bill these. Number one, from a charge capture perspective. Number two, from a regulatory compliance perspective. And then number three is that once you understand the specific requirements for each of the different services, what I found is that physicians can typically document the higher levels of service by using considerably fewer words in their notes. So what currently we see is a lot of times physicians are documenting an extensive 2 or 3 page note, billing it out as a level 4, but maybe they're missing 1 or 2 key words in the documentation, so it might be overcoded. Once you understand the concepts that I'm presenting here, you'll be able to create a 2 or 3 paragraph report that'll support a level 4 and sometimes a level 5 visit. So understanding the documentation is really beneficial in each of those 3 ways. The next slide here shows you kind of a little bit more granular detail regarding what goes into supporting the different levels of service. And what it shows here at the top is that within the history component of documentation, there's actually 3 subcomponents: the history of present illness, the review of systems, and the medical, family, and social history. Now, I'll go into each of those in a little bit more detail here shortly, but one of the concepts that's really important to understand is that when we're using the history component of documentation to support any given level of service, all 3 of these subcategories need to be met or exceeded. So if we have an HPI that gets up to the highest level and the medical, family, and social history gets up to the highest level, but the review of systems is lacking just a little bit, that one deficiency is going to hold back the entire history component of documentation, and that could very easily limit your level of service. So with the history component, it's truly all or nothing. When you look down here at the bottom calculation, which is the one that looks at the complexity associated with the visit, we've got basically 3 different calculations that determine how complex the patient visit is. The first one, we're going to illustrate how to come up with a value that quantifies the problems that the patient's coming to you with. So you get a little bit more credit for a new problem than an established problem. You get more credit for a problem that's worsening than one that's stable. Each of these are going to add up to a number, and basically to get to the highest possible level of service, you have to have a value of 4 in this calculation. Similarly, with the data calculation, we're going to quantify the variety of data like test results and reviewing old medical records that are associated with the patient visit. A value of 4 in this calculation puts you up to the highest level. And then the last variable here is risk. They actually give us a table of risk that shows 4 different levels of risk that the patient can get exposed to, and it gives us kind of examples of presenting problems, of diagnostic workup, and of management options. The highest level of risk that the patient gets exposed to in any one of those 3 categories is what determines the overall level of patient risk for the patient encounter.